So we'll be discussing about the management of a handicapped child in dentistry or by a periodontist. So a handicapped child has certain exchangeable terms which are used for a certain particular child, that is the special child or a disabled child or God's forgotten children. So a handicapped child have special disabilities which do not help them in leading the proper lifestyle as normal individuals. So handicapped child is one who over a period of time is prevented by certain physical or mental conditions from full participation in normal activities of the age group, including social, recreational, educational and vocational nature. That is, a handicapped child is restricted by various abnormalities, whether at the physical level or the mental level or the psychological level, and these abnormalities prevent in maintaining the proper day-to-day activities of a children which the normal age group of children would perform, like any social activities, recreational, educational or vocational type of activities. Any communication type of activities are not kept up properly by such handicapped children. So such child is known as a handicapped child or the God's forgotten children. Now let us know what is a dentally handicapped child. A dentally handicapped child is one who is prevented in maintaining the proper aesthetics or the mastication and the proper nutrition due to certain dental problems or restorative problems or any pain or any functional defect in the dentition. Now, what is the classification of a handicapped child? It can be classified either into a physically handicapped like monoplegia, quadriplegia, polyplegia, then biplegia. Then there is a physically handicapped child, then comes a mentally handicapped child whose intelligent quotient is very low, and certain mentally handicapped children like with having Down syndrome. Then the sensory handicap, whether a deaf, a dumb, a blind child. Then a medically handicapped child like a hemophilic child or leukemic child. Then a multi-handicapped or a pan-handicapped who have certain many handicapping conditions which make the handicapped child. There was another classification which was put forward by Novak, who told that the handicapped child is classified into a physical handicap with having the cerebral palsy or monoplegia, quadriplegia, biplegia, then a mentally handicapped child who is mentally retarded like in Down syndrome. Then the first is a physical, then is a medical, then is a congenital handicapped child or having congenital heart disease or any hemophilia disease. Then are the convulsive disorders like cerebral palsy or epilepsy. Then are the coagulopathies or the communicative disorders like the autism, the blindness. Then there's the systemic disorders. Then comes the metabolic disorders like the juvenile diabetes, neoplastic disorders and hematological disorders. Then broadly, the handicapped child can be classified into the medically handicapped or the developmentally handicapped child. Now, as a whole, how can we treat a handicapped child, or what are the certain modalities by which a handicapped child can be treated? First of all, the appointments. We should keep in mind that the appointment for a handicapped child should be kept as early as possible, and the visit should be as short and as few as possible so that maximum benefit of the work can be given to the handicapped child in the minimum time. So a dentist should arrange their instruments properly beforehand, and they should always be away from the sight of the handicapped child, because the handicapped child may develop apprehension towards the treatment or the instruments, so they may refuse the treatment at all. So a handicapped child should always kept morning appointments. Appointments should be short. The appointments should be swift. Then the radiographic examination or any investigations can be done by the means of keeping a bite tab or a radiographic tab. Then a bite block can also help. Then the preventive dentistry strategies should be forced, or they should be impacted or kept in mind by treating a handicapped child. At home treatment should be used. They should be encouraged to use certain electronic toothbrushes or toothbrush modification like tennis ball modification, long handle modification, which help in a handicapped child from brushing and keeping their oral hygiene properly, because they do not have certain manual dexterity which a normal child will have. So such children should be given certain toothbrushing modifications. Their healthcare or caregivers or even mothers and fathers should be educated about the importance of oral hygiene and various techniques which will help in improving the oral hygiene of a handicapped child, because they always suffer from a poor oral hygiene due to inability to brush properly or poor manual dexterity. Next, as the handicapped child should maintain the proper diet and nutrition, because they may have certain dysphagic problems or swallowing problems. So proper diet analysis and diet counseling of the handicapped children should be done. Regular fluoride application and Pittel Fisher sealant application should be emphasized. So preventive dentistry is an important part in treating a handicapped child. So regular oral prophylaxis should always be done. Now, there are various behavior modification strategies which are kept in mind for a handicapped child, because a handicapped child may always certainly tend to be an uncooperative child. For example, in treating a handicapped child and treating a normal child is always different. There are various other invasive strategies which are involved in management of a handicapped child, like the general anesthesia, the conscious sedation, immobilization by the use of Papu's board or pediraps or bean bags. So these are the various strategies. Let us discuss each individually. So treatment immobilization, that is immobilization of the limbs or the extremities of the handicapped child to prevent them from lashing of arms or feet or unwanted movements which are made by the child. The various indications are, for example, any psychological or developmental immaturity, then in the case of any unwanted movements like cerebral palsy patients, and for the safety of the patient even immobilization can be done, or in a very young child. So there are certain contraindications for the procedure, like the children who are cooperative and the children who suffer from high mental retardation or who are not able to understand or who are having any medical complications. So in such cases, immobilization is not referred. So there are certain techniques for immobilization like the pedirap, the bean bag, the hand and towel or the tape and towel, and then bite blocks which are kept in mouth, and then Papu's board, which is a board in which the entire body of the child is fixed and then the treatment is performed. Then there are certain tongue blades which prevent the tongue from unadvanced movement, and the mouth props. Now, there's another way of treating the handicapped child, or the behavior modification strategy, is the nitrous oxide anesthesia or the conscious sedation. In such cases, the child will be sedated for a particular duration of time, and the child will obey to the commands of the dentist easily by the means of this sedation. The child will completely not go into sedation or the period of unconsciousness, but the child will be conscious stage, and the child will obey to the command, will not resist to the command of the dentist during the treatment. So the indications of such sedation are any medically compromised child, or the mentally handicapped children who do not understand properly, or the children who are extremely apprehensive towards a particular behavior, or who require short appointments. So these are not required, or conscious sedation is not recommended for mentally retarded children or any emotional disturbance. Then comes the general anesthesia, which is a final resort for the treatment of any child. For example, if the child is not able to open their mouth at all, then we go for the treatment under general anesthesia. In the case of children where the full mouth treatment is required in the single sitting, or the children are uncooperative or that they could not visit to the dentist at regular intervals or various procedures, and in such cases also general anesthesia is recommended. In the case of medically compromised children like hematological disorders or any cardiac abnormalities or any highly definitely negative behavior of child, also recommends for the use of the general anesthesia. So let us know what is Down syndrome and what are the various oral manifestations of the syndrome, and how are the oral implications and the treatment of the child with Down syndrome. So Down syndrome is often called mosaicism or Mongolism also, and it is due to the chromosomal translocation or the deletion of the 21st chromosome. The etiology of the Down syndrome is generally the mothers who have late babies who are like more than 30 years or 34 years of age for having the conceiving the baby and delivering the child. In such cases, the patients or the children are more probability for the Down syndrome. Now let us know what are the various clinical features of the same. A Down syndrome child is generally highly mentally retarded, less than 50 IBS of the mental intelligence quotient. Then the children can have slanting eyes, and there will be epicantral folds over the eyes which are present at the corner of the eyes. Then the palpebral fissures will be very small, the ears will be small, the jaws will be small, the face will be brachycephalic or the floppy like and have low muscular tones in the extremities. Even the nasal bridge of the Down syndrome baby will be flat and underdeveloped cheekbones and small ears and a wide neck. Then the oral manifestations include there will be microdontia and spacing between the teeth. Sometimes the jaws are also micrognathic in the Down syndrome patient. There will be sometimes open bite or cross bite also present in the Down syndrome patient. The palatal vault will be deep and V-shaped or highly arched. Then the Down syndrome patient generally have taurodontism or more probability of large bull-like teeth in which the crowns are shorter in the expanse of the root and the bifurcation is more apically placed. Then these children can have early eruption or delayed eruption problems, early exfoliation, and there's certain probability of the gingivitis to occur because the host immune mechanism is low. There will be incomplete this development of the midfacial complex, and sometimes they may also be associated with cleft lip or cleft palate. Now, the general behavior of the patients with Down syndrome is that they are very affectionate and friendly, and they can be easily managed in a dental clinic. Once a child becomes friends with the dentist, then they can be easily managed with further appointments. Then the Down syndrome patient, if the child is apprehensive, can be managed by nitrous oxide anesthesia or nitrous oxide sedation. If the child is extremely uncomfortable, then we can go for general anesthesia for extensive procedures, and in the case of mentally handicapped children, certain other procedures are incorporated. As we all know, the incidence of caries and gingival disease in a Down syndrome patient is more, so we can also go for certain preventive strategies like topical fluoride application, regular oral prophylaxis, mouth rinsing, and we can administer or deliver the patient proper electronic toothbrushes for the maintenance of the oral hygiene at home. Now, what are the learning disabilities? So there are certain patients which, due to certain intellectual disability or psychological or emotional disability, then there are certain psychogenic factors will lead to inability of the patient to read, to write, and to relate or communicate. So such patients are having learning disabilities. Generally, it is more present incident in males than that of females. Now, there are certain clinical features of such type of patients, of such children. They have difficulty in reading, they may be deaf, they may be blind, they may have the inability to comprehend or understand a particular word or a particular subject. They find difficulty in lecturing, or they find difficulty in speaking and communicating with their own age group children. So such disability children have the physical features of a prominent jaw, then the face can be long, the jaws can be prominent or class 3 malocclusion, the nasal bridge would be flattened, and even in palm, the simian crease will be present. The treatment of such patient, they require proper general anesthesia or conscious sedation if they are uncooperative. Now, what is fetal alcohol syndrome? If the mother takes alcohol during the first 2 months of pregnancy, then the child may suffer from certain cardiac or neurological or psychological problems and even the growth retardation. So such a patient is having the fetal alcohol syndrome. In such patients, the epicantral folds will be present over the eyes, the palpebral fissures will be small, then the upper lip will be thin, the nose will be everted upwards or the philtrum will be absent, the nose will be very short, and there will be also mid-face deficiency. Then there will be sometimes there will be absence of cheekbones, there will be micrognathia and microdontia which is present in children. Microcephaly is also present, and the face will be brachycephalic. The general physical findings of the oral cavity may have the cleft lip or cleft palate, and crowding or the crossbite, and there's an increased incidence of skeletal and dental malfunctions. The management of such children is by general this behavior management strategies, or they can be managed easily. Now, autism. The term autism was given by Karma in the year 1944. So, autism is nothing but an intellectual disability or the disability to communicate or relate to each other due to emotional or psychological undevelopment. It generally occurs at the age of 3 years, and sometimes more often it goes unnoticed. An autistic child is extremely apprehensive in the case of any, like if they are facing any fearful situation, then the child may be extremely apprehensive and will not obey to the commands. They have the more concept of no. They can have repetitive singing or repetitive nagging out of words, which is known as parrot-like voice. They have sometimes they do not communicate with at all with anyone, so they have this thing of extreme loneliness and do not able to relate properly with their co-beings. They have also certain swallowing or eating disturbances, and then they have intellectual disturbances. They also have sometimes obsessive compulsive disorder and difficulty in the ability of saying yes. The treatment for such children, they should be treated very slowly, and very slow commands should be given. We should try to become friendly with such patients, and if they do not at all understand with the commands of the dentist, then conscious sedation or general anesthesia, then nitrous oxide sedation is the last resort. Sometimes the extremities can also be fixed, and the treatment can be done by the means of a Pappos board. Now coming to the blood coagulopathies, that is the hemophilia. So hemophilia is the coagulopathy of blood or bleeding disorder which is due to the inherent tendency or the absence of factor VIII, which is a anticoagulant factor which is present in the blood. Now the hemophilia is affected more in males than that of females. Females are generally carrier of the hemophilic gene. The treatment of the hemophilia incorporates the administration of factor VIII or factor IX or whichever type of hemophilia is there before any dental treatment. Then the oral features of a hemophilic person are there will be oral hemorrhages. Sometimes There will be spontaneous hemorrhage in the case of the severe hemophilia, or on brushing the child or the patient may suffer from bleeding episodes, or sometimes even on under trauma. If the patient is having a trauma, there will be the bleeding will not stop easily in a hemophilic patient. So they also have certain pseudo tumors which are present in blood due to, or the bone which are present, and this is due to the internal bleeding. The mouth lacerations, they have more incidence of gingivitis and periodontitis and gingival bleeding, and the caries and the periodontal disease are more present in the hemophilic patient. So the treatment of the hemophilic patient varies differently, and appointments should be kept as minimum as possible. Then the preventive approach for treating any disease, preventing from any disease to be more aggravated. So treatment at the first level or the primary level should be done in a hemophilic child. The preventive focus is on fit and fishes sealant, and then the fluoride application or any preventive resin restoration, and any pediatric dentistry which is needed is given to the children. Then traumatic restorative restoration is a treatment, is a treatment of choice. Then in before the injection or before extraction of the teeth of the hemophilic child, it should be kept in mind the factor 8 or factor 9 or whichever type of hemophilia is there. The half an hour before, this factor should be injected in the blood of the child. Then during the time of the extraction, proper gelatin foam, and after extraction the wound should be covered by a gel foam, and proper curettage of the socket, and the fibrin glue should be placed in the wound. So these were the treatment of a hemophilic child, and various type of medical and developmental or psychological disorders in the handicapped child and their dental treatment. Thank you.